Thank you for joining today's virtual educational program with Cancer Support Community Los Angeles. I am Edlyn Relarte, and I am the Virtual Program Associate at CSCLA. I welcome you to this week's webinar titled, How to Work Well with Your Healthcare Team. Navigating healthcare can be confusing and daunting. To reduce the confusion and help us understand the different roles of healthcare teams, Ayaka Nakaji and Sarah Lowe will be joining us today. They will share the information on how to communicate with different team members, advocate for yourself, and maintain great relationships with them along the way. Before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization providing vital social and emotional support to families facing cancer, including patients, caregivers, and their loved ones, all at no cost. Our programs include support groups, healthy lifestyle classes, social activities, and educational programs such as this one. If you'd like to learn more about our services or watch past webinars, please visit our website at www.cancersupportla.org. Without further ado, I'd like to welcome today's speakers. Sarah Lowe is an oncology nurse navigator at Cedars-Sinai Samuel Ocean Cancer Center with 10 years of experience in inpatient hematology-oncology and nursing education. She has supported interdisciplinary work such as the MD-RN Collaborative and is passionate about supporting patients through the care continuum. Joining Sarah is Ayaka Nakaji. Ayaka comes with 10 years of social work practice in community mental health, case management, and medical social work, and has worked as an oncology care coordinator at Cedars-Sinai since 2019. She believes that healthcare is a right, and she is passionate about improving access to quality oncology care for all. Welcome, Sarah and Akaya. Thank you so much for joining us today. Hi.
Hello. Good morning, everyone. My name is Sarah Lowe, and Ayaka, why don't you take it away?
Good afternoon, everyone. Thank you so much for having us. Today, myself and Sarah will be talking about how to develop good communication with your healthcare team. Today, so this is today's overview of the presentation. We are going to discuss your care team members. Who are they? What do they do? What are some of the roles that your care team members play? How to best report your symptoms, how information privacy works, services and programs that may be available to you, which includes home health, specialty pharmacy, and mental health support, plan and advanced care planning conversations. Lastly, we'll touch on understanding healthcare lingo that may be confusing to all of us. And we will do a quick Q&A at the end as the time permits. So we'd like to kick us off with a quick polling question. So if you could answer this question that comes up on your screen, on average, how much information could you recall from your visit with your oncologist? A, very little, B, not much, C, a lot, D, I recall every single detail. I'll give another maybe 5 seconds. Okay, let's see the poll. Okay, so yeah, 67% not much, a lot, and there's one person that says I recall everything, which is great. Thank you for answering this polling question. And the reason we asked is this, that it's very, very common to not remember a lot of conversation that you have with your healthcare providers. In a 2018 study, patients only remember about 49%, so about half of the decision and recommendations made during talks with their doctors, leaving many with limited influence on the course of their case. So why is it so hard to recall what my doctor tells me? There is a natural physiological reaction to perceived danger that we have. It's called fight, flight, and freeze reaction. So when we are in actual danger, these reactions help to protect us from escaping danger. However, when we are in a very stressful situation, similar physiological reaction also happens, which really hinders our ability to listen and process information. Your palms, may be sweating, your, heart may be racing. And when we are in the state of mind and body and state of mind, it's very hard to process and listen to the information. And in addition to that, medical jargon, medical providers are notorious for using a lot of medical jargon that may or may not be able to be easily understood by their patients. So this also hinders our ability to listen and process information. So a few techniques to start with. You can write down your questions prior to visit. So this can be done on your notebook or on your phone, whatever the way that is easier for you. Bring an extra set of ears, and it can be either in person, so you can bring someone physically with you, or by phone. You may have a trusted friend or family member that lives outstate, and it's perfectly okay to bring that person on by phone. Try what if questions. So you can frame questions as, what if I have an urgent question outside the clinic hours? Who can I call? Which number should I call? What do I need to do? What if I'm having very severe side effects to the treatment? What do I need to do? Who do I need to call? Try repeating what your doctor just told you. So essentially summarizing what's just been discussed. So what you're saying is that the next plan of care is that I will go through 5 rounds of chemotherapy, followed with radiation, to really assess your understanding is in alignment with what your doctor just told you. Write down the information being shared during the visit so you can review your notes later. Your doctor can make referrals to many types of providers within the clinic, so it never hurts to ask social workers, dietitians, psychiatrists, palliative care medicine doctors, and so on. And what services available to you may be different from institution to institution, but it never hurts to ask. Use technology to your advantage. Most healthcare institutions nowadays have electronic platforms that you can access either on your computer or on your app. And it can be a really good, efficient way to communicate with your providers. You can message your care team members via those platforms.
Okay. Hello, this is me. Let me see. I am trying to get this to control. Okay, so let me talk about reporting symptoms. The biggest kind of recommendation I can make in terms of giving symptoms very generally is to spend some time thinking about it. I don't know if you've ever had to try to report any sort of symptoms. It can be really hard. I know I injured my back, and the physical therapists were like asking me, okay, so like, where is it? Like, what's the extent of it? Like, how would you describe it? And it was hard. So anything that you can, any information you can give your healthcare team, the better they'll be able to serve you. So taking notes is a great way to do this. Think about location as in where in the body you're having these symptoms. The time as in, are there certain times during the day when you're seeing this happen? How long do these symptoms last when they do occur? So that's duration. Description, you want to give more descriptions. You're going to give as many adjectives as possible. So you can say, I have pain, but the way pain can be perceived or felt can be so incredibly wide. So any sort of descriptors you can provide, it's throbbing, it's sore, it's aching, it feels like I'm being stabbed, it feels like I have a lot of pressure pushing against my rib. Any sort of descriptions will be helpful. And then severity. So your doctors are going to want to know how much this is interfering with your life and how difficult it is. We'll talk more about that scale in the next slide. So really, unfortunately, because this is a talk that isn't centered on reporting symptoms, I would love to talk a lot more about what your doctors would be interested in. But the short answer is everything. They care about everything because you are a whole person and all of your symptoms can mean certain things. So just to highlight a few, confusion, dizziness, anything that's going to affect the way you think, like you're feeling confused, your loved one, if they're having any confusion or having difficulty answering questions, difficulty, what we say, word finding, those are things that doctors will really want to know. Weakness, any issues with breathing, any issues with swallowing, because we're always concerned to make sure that patients are going to be safe when they're breathing, they're not going to be choking, they're not going to be what we call aspirating, where food or fluid is going into the lungs. Of course, pain, your ability to walk and function, that's we call mobility, bowel movements. So we are always interested in bowel movements and urination. So we'll get really comfortable talking about that. Nurses and physicians and healthcare providers love talking about that. So yes, as a caveat, I'd like to just put a word out there that we do, make accounts for yourself for anxiety, because anxiety can make symptoms so much worse. And even if you don't call it anxiety, I don't know, maybe the power of your mind. I once, like the same issue that I had with back pain, where I actually had nerve pain. I'm going to share an embarrassing story because it might help some of you. Is I was having all this nerve pain and it was out of control. No one could figure out, I should be responding to the physical therapy appointments, but I kept having all this nerve pain. And then one day, I don't remember what triggered me, but it occurred me to try to create nerve pain on my other leg. And I did. And I realized that I was actually creating my own nerve pain. And that I was actually doing much better than I thought. And I went back to my physical therapist. I didn't explain that. I was just like, oh, my nerve pain went away. So just saying, be aware that we do see this in the hospital. This happens to all of us. So just be aware of that, and also aware that some symptoms are honestly quite random and they disappear. I can't even name the amount of times a patient would report a symptom to me that wasn't like urgent or emergent, but was odd. And I was just, okay, let's monitor it. Let's see how you're doing. And I would never hear about it again. So we'll just keep those as caveats in your mind. The best pro tip I can give you all is really to keep your own record. I said notebook here. It says, pro tip, keep a notebook of all your treatments, dosages, durations, and dates. It could be an iPad. It doesn't have to be a physical notebook, but I'm sure it won't surprise any of you to say that communication in healthcare is absolutely terrible. I'm sure you have all experienced that, or soon will. There's just so much that goes on, so many providers that are involved. Also, you are not going to be able to remember even very important things that you think you would remember, like what chemotherapies or radiation treatments you've had, just because so much happens. And there are also, you're likely to go to different healthcare systems over, the period of receiving care. And your healthcare provider may not have the kind of easy access you would expect them to have to all the parts of your care. I know one thing that's really frustrating to patients is like, it's in my chart, shouldn't you know? And then unfortunately, because our electronic health records are so vast and very complicated, and also not everyone is going to have the same access as other people. So I, as an ambulatory nurse now, don't have the same information to what you may have had in your hospital stay, and vice versa. So unfortunately, not everything is going to be quite as transparent. So anything you can provide your healthcare providers, any that will help you to advocate for yourself. And we do really, really love when patients are their own advocate. We just really love respectful and kind advocates, but we do really, really want you to be advocating for yourself. That assures us that you're going to get the care that you need, because we really want you to get the care that you need. It's just that we're very busy. So please, that is a great tip that I can provide and has been very helpful when I see patients provide that. We're going to talk about the Wong-Baker face scale real quick. That is a scale from 0 to 10. And we can apply this really to any symptom, but it is most often applied to pain. And I'm sure you've seen this scale somewhere where someone has told you, okay, tell me how much your pain is from 0 to 10. And you're like, I don't even know how to answer this. Well, 0 is absolutely no pain whatsoever. 10 is going to be the worst pain imaginable. I want to talk about a functional scale that was developed at Cedars-Sinai on our orthopedic unit, which I feel is very helpful. In the hospital, traditionally, mild is going to be considered levels 1 to 3, moderate is level 4 to 6, and severe is level 7 to 9. And if it's mild, it's something that you feel the pain, but you can still complete most activities. Moderate 4 to 6 is going to be pain that makes it difficult to concentrate and may interfere with your ability to do certain normal activities like reading, watching TV, having a phone conversation, etc. So this is still a pretty big impact. Severe 7 to 9 is going to be pain that is quite intense and is causing you to avoid or limit physical activity. It's making it so that you can't concentrate on anything except the pain. So that would be level 7 to 9. This is also going to be really valuable for you to know, because when you're in the hospital, doctors are going to have to order any sort of pain medication and give the nurses instructions on when they can give certain medications based on the scale. So if the patient is reporting mild pain, they can take this medication. If they're reporting moderate pain, they can give this medication, and severe pain, this one. And so sometimes you're going to have to clarify and talk with your doctors and your nurses so that the orders will match what it is that you actually need, because you might have a pain that's very severe, but want to take the Tylenol, which is what the doctor has ordered for mild. And so that is something that you'll have to work out with your team to make sure everything matches and you can get the medication that you need. Okay, information privacy. We have the famous HIPAA Act, Health Information Portability and Accountability Act, which was designed to really help protect your privacy from being shared from your providers sharing to people who shouldn't be told that information, which is a really wonderful thing. It can make things a little difficult, however, because of the fact that pretty much all the cancer patients I know have teams that are behind them, family members, friends who are actively participating in their care. But we as healthcare providers can't freely give information, even if these persons are really on your team and are really helping in your kind of healthcare journey. But there are some things you can do to make it easier for them to have access to information if that is what you want. Sort of one of the easiest ways is to sign something called a protected health information form. Every institution should have one, and you can have that signed and give the name of the person you're giving full access to. If we have that document in the chart that's easily accessible, then really any healthcare provider who has access to the chart and can see that form can say, oh, sure, I see that you're here. Sure, I can give you the information that you need, and I can help arrange appointments with you or tell you about what the care plan conversations were. So a PHI is a very helpful one. Another one is to designate somebody as your durable power of attorney. I've seen in most health systems that even if you don't sign an official paper designating someone as your durable power of attorney, which means that if you were unable to make your own healthcare decisions, that this would be the person who we would go to. That is like a legal document, but even if that is not designated in a legal document, as long as it's designated in the notes, like, oh, this person, the patient has stated this person is the DPOA, that will give us clearance to speak to that person and share the health information that's needed. Another shorthand I would use, if I was in the hospital, someone gives me a call, I'd basically just walk into the patient's room and just be like, is it this person called? Is it all right for me to talk to them? The patient says yes, then we're good to go. In the hospital, some units would also do something called designating passwords. So there would be a designated password. If someone called asking for information on a patient, we might say, okay, do you know the password? And if they knew the password, we knew that we had clearance to talk to them. So there's different methods that different teams will use to try to ensure that your information isn't just publicly being shared. But yes, I know that that can be a struggle. Electronic medical records now, most of you, because of the laws that are in place, should have access to some of your electronic medical records, which is a wonderful thing. But not everything will be available through just accessing the online portal. There are going to be some things that will require for you to actually send in a form to request for. So just to be aware of that. Okay, care team members, you have a lot of care team members. It is very, very confusing, and we just want to affirm just how confusing it is. There has been some research demonstrating that patients who are hospitalized will interact with upwards of 75 individual persons a day. It is crazy. There are a lot of people on your team. And we just want to affirm that it's not you, it's us. So let's go over just some of the care team members you are going to be interacting with. We have our physicians. And then of course, within our physicians, we have lots of different specialties. We have oncologists, we have general oncologists, like medical oncologists, and then we've got specialty oncologists, surgical oncology, gynecological oncology, neuro-oncology, and so on and so forth. And not only with oncology, there are many different parts of your body. So we are going to have other specialties as well for those different parts. And we, including psychiatry, palliative care, and so on. We have advanced healthcare providers who are going to be working very closely with your doctors. This is physician assistants and nurse practitioners. We'll talk more about what they can do and their part in the team. We have this group of nursing, which is a very wide group who can do lots of different things. We'll get into them as well. We have what we call our ancillary team members. These are our amazing team members, but they just don't fall into those three categories of physician, advanced healthcare provider, and nurses. So social work, speech therapy, physical therapy, registered dietitians. We'll talk more about them as well. And we also have, of course, our administrative persons. Okay, talking about physicians, you will see a number of different letters behind physician's name. MD and DO, they both have the ability to practice medicine. We hear more about MDs than we do DOs, but DOs are doctors, and both of them can treat you. A PhD is going to be, doctor of philosophy, and if you are being treated by a doctor of philosophy, they will also have an MD. In your physician team, you are going to have an oncologist, like a head oncologist. You will also still need an internist. This is the person who would be in the middle talking to all of the other specialties. And since I will say that for some patients, when oncology becomes their primary need, sometimes the oncologist will kind of take over the role of the internist, also known as the primary care provider. But most people are going to have an oncologist, also an internist, also known as a primary care provider, and then you'll have a series of other specialists. And that internist is going to be the one in the middle who is doing the communicating and the coordinating with all the other parties. Scope of practice, the scope of a doctor's practice is to diagnose, prescribe medication, and to treat. And I do set that up also because doctors have the ability to do a lot of different things, but they're not necessarily going to be the ones to do everything, because the doctors have such big roles and are very busy and aren't necessarily going to have specialty knowledge on everything. And so keep in mind that doctors are great people to ask questions for, but they're not necessarily going to be the ones who can actually help you navigate, say, the healthcare system, or navigate insurance, or figure out these very practical things that you actually are going to need. So just keep that in mind. Part of what our talk today is going to talk about who might be the best people to triage for the questions that you have and for the needs that are going to come up for you. And we do want to set up some realistic expectations. Most doctors, unfortunately, just don't have the ability to respond to calls right away. So you can expect that if you reach out to a doctor, if they are going to give you a call back, it is most likely going to be at the end of the day after their clinic hours. Some doctors have the ability to respond sooner, but realistically, if they are going to be able to call you back, it is most likely going to be at the end of the clinic day. And if you send a message to a doctor at a baseline, kind of just in your head, expect a 48-hour window to give them an ability to respond. If there are more urgent needs, then there might be other people to reach out to. It depends. We'll talk more about that. But if it is a question that's not urgent, just expect at least a 48-hour window. And it is going to help you to learn how your doctor's office works. So like what modes of communication does your doctor's team tend to use the most, so that they'll actually get the message. For example, some doctors' offices, they might not necessarily check the voicemails like frequently enough for that to be the most helpful method of communicating. If somebody doesn't pick up, it might actually be messaging by email or so on and so forth. Also, like we talked about, we really, really do want to let you know how much we appreciate when patients are their own advocates. Please, please ask, because you don't know. The doctor might be able to advocate for you, might be able to do certain things, might be able to order things. We just ask that you ask nicely, please. Also want to mention that sometimes there is a tendency for patients to feel like, I need to be a good patient. And we would see that in the hospital where patients would not necessarily they would be telling the doctors one thing, and they would be telling the nurses something different. So please keep that in mind, because if you can give the team the same information, that really helps nurses and team members to be able to advocate for you. Because if a patient has told the doctor one thing and then has told the patient another, and then I'm going to try to advocate the doctor, it will be confusing for the team to be like, oh, but they told me there wasn't any issues. So just to keep that in the back of your mind, you might not even realize that it's a tendency for people to do. Advanced healthcare practitioners. These are physician's assistants, PAs, nurse practitioners, a certified nurse midwife, certified nurse anesthetists. You are most likely to interact the most with PAs and NPs. These are the people that you should know in your doctor's team because these are the people who tend to be the ones who are going to be the go-to people to answer your questions and to get back to you for things that are more urgent or that you need information on. So you really want to know who these people are on the team, because these people tend to be the doers on the team, kind of get the grunt work, get the messages, like figure out what patients need, get those practical things done. So really know who that person is on your team and know how to get in contact with them. Is the best piece of advice I can give there. And just to explain really quickly, PAs and NPs, what makes them particularly such wonderful go-to people is because they have the ability to put in orders and they have a very trusted relationship with the doctor. And so they will be able to just make things move much more quickly. There are going to be so many nurses, plethora of nurses. Here are some acronyms that you may have seen. And I will just say, for the amount of, if you can think of all of the potential specialties that exist in medicine, there will be a nurse counterpart. So there is going to be a huge scope of what nurses are capable of doing and have specialty knowledge in. Nurses, their job, their scope is to implement the plan of care. So something to keep in mind is that nurses can't order things, and that is going to limit their ability to be able to do things for you. Nurses are amazing advocates, but they can't actually make a doctor do anything. So just please keep that in mind of what they are able to do for you. Because they can't say, you know, you really need a certain medication, but without a doctor's order, a nurse can't actually provide that for you. So just to keep that in mind. But like we said, nurses do have specialty knowledge. So one of the best advices I can give is to be finding out what specialty knowledge different nurses have. So example, you know, you can ask them, what do those letters at the end of your badge mean? They might say, I'm a wound ostomy care nurse. That is amazing. Write that down. Anything you have to do with those issues, that's the nurse you're going to go to ask questions about that. Nurse who is in the infusion center is like, oh, hey, you're going to be my the person I ask about chemotherapies. If you find those people with specialty knowledge, that is going to be really, really helpful. Nurses are also great people to go to ask, who should I talk to in order to find out this information? Because nurses, you know, have more information on how the healthcare team works. They might not know, but they might be able to help you. Maybe you're like, hey, I'm having trouble with this insurance thing. I don't know what to do because I'm having trouble with this or that. Nurses are great people to go to who can help kind of triage you. Another tip I can have is when you're talking to a nurse, let's say you're asking for something in particular, it's helpful to verbally share the level of urgency. That will help the team members to be able to triage the different questions that are coming in. For example, something like, you know, I'm quite anxious about it. Would it be all right for me to follow up at this time? So if you set a time of which to follow up on, that will also let the team know, like we've already set that up to begin with. So you don't have to feel like I'm badgering the team, but they also are aware that you are going to be following up with it at a certain time. This is all going to be very helpful because of the enormous amount of questions and tasks that come into a team. Of course, if everything that you request is at the highest level of urgency, that's going to make it very hard for your team to triage. But if you just use that judiciously, they will take that seriously and do their best. Like I said, be your own advocate. We really do love it when our patients are advocates. When patients don't ask me questions, then it's when I worry for them that they're not getting all of their needs met. We just want kind and respectful advocates. We love you. So please be your own advocate, ask lots of questions. Can be helpful to note all of your concerns, build relationships, demonstrate appreciations. Nurses work incredibly hard. Everyone in the healthcare team does. Demonstrating that appreciation and building the relationships is going to be beneficial for everybody. And nurses are advocates and they're going to bend over backwards for you. So please appreciate them. I'm going to turn it back over to Ayaka.
Thank you, Sarah. So I'm going to quickly go over roles of social workers. So your healthcare team most likely has at least one social worker on staff. And for social worker titles, you might see MSW, Masters in Social Work, LCSW, Licensed Clinical Social Work. So that means that, we have had at least a few years of supervised clinical experience and have passed an examination to be licensed. Oncology Social Work Certification, OSWC, which demonstrates that the social worker has additional years of experience and certification. CCM means Certified Case Manager. This can apply to social workers as well as nurses. And Advanced Certified Hospice and Palliative Social Workers. So these are just some of the titles that may signal you what types of experience that the social worker may have. Some of the social work services that can be offered: emotional support to patients and their loved ones, facilitate communication between patients and their care team members. If there are issues, social workers may be able to be sort of like intermediary and facilitate better communication between the care team members and the patient. Provide education on the advanced directive, which we'll go over a little bit more later. Help with applying for public benefits. It's incredibly challenging and complicated to navigate these public benefits system. For instance, Medi-Cal, state and federal disability benefits, in-home support services, all these things. Social workers can help you sort of navigate the system and provide you with necessary information for you to be able to apply for the benefits that you may be eligible for. We can also provide a linkage to community resources. So because we work within the healthcare system, there is a limitation as to what we can do. That's why we love collaborating with our partners in the community, such as cancer support community. We make referrals, to our patients to cancer support community chapters very, very often. So we provide linkage to those resources that we may not be able to provide as well.
Okay, this is going to be the briefest word about other supportive services, which they deserve much more, but we are short on time. So our ancillary support services, I just wanted to highlight them really quick. These are going to be wonderful resources, and if they are available to you, then please take advantage of them. Physical therapy is going to work a lot with mobility, particularly when it comes to walking. The technical term we use in the hospital is ambulation, so you'll probably hear that. So anything to do with gait, walking in particular, but other things in terms of mobility can be under their sphere as well. speech therapy, these persons are going to be looking at swallowing. So any difficult with swallowing and anything to do with using your voice, because of course, with different cancer treatments or different cancers, this can get affected. And if ever someone needed a tracheostomy, which is if you've ever heard of a tube going in the throat to help somebody breathe, a speech therapist is going to be involved to kind of make sure that that's being used safely. A dietitian, all information about nutrition, incredibly helpful. There's all sorts of research about how all of these different ancillary services, including spiritual care, have a meaningful impact on patient outcomes, like how patients do in terms of their treatment and their symptom management. So please do take advantage of them. The doctors may order home health. So that is going to be dependent on your insurance and other things. But home health would mean that when you are, let's say, discharged from the hospital and came home, that someone might be able to come to you for a certain amount of time and provide some of these treatments like physical therapy or speech therapy. The only thing I'm going to say about administrative personnel, so these are our secretaries and so on and so forth, is please appreciate them and treat them well. These are going to be sort of informal people, people in your doctor's office who often are like informal leaders. They'll tend to know like what's going on, like who might be out. And so maybe they won't get the message that you need to send. What's going to be the best avenue to try to reach a certain provider, helping with scheduling, all of that. They are going to be very, very helpful for you. Even they might not have a specialty medical knowledge, but they can be incredible advocates for you. So please treat them well and please appreciate them. Quick word on prescriptions and pharmacy. A lot of you are going to interact with specialty pharmacy. This is in particular for high cost, high touch medications for patients with complex disease states. And this often is going to include chemotherapies or other anti-cancer medications like biologics, or there's so many medications that don't necessarily fall under the chemotherapy umbrella, but is necessary for cancer treatment. And because these medications are very expensive, sometimes we are going to have to jump through hoops to get you what you need. And so what you're going to see is there might be some strange things that you interact with where they say, hey, we're going to need, you might be hospitalized, but the hospital might ask you, is there somebody who can actually pick up this medication at CVS and bring it to the hospital? There's all sorts of hoops that we might have to jump through. So if you do need assistance with these high cost medications, what the people you are going to talk to is specialty pharmacy. And that's going to be some of the reasons why we're doing some very strange things. I just wanted to also mention that pharmacists are really, really amazing resources. Some healthcare systems have pharmacies provide discharge phone calls or have pharmacists review your med list in the hospital. If you ever have access to a pharmacist, I'm going to really encourage you to take advantage of them, because these are the persons that doctors will call to ask questions to. Ask them all the questions about your medications and your treatments. They are amazing resources. They have doctorates, they have doctors in pharmacy, they have studied for an incredible long amount of time. A pro tip that I am going to share is that whenever you call any doctor or any team member for a medication request, every time you call, just give them the pharmacy name and address where you want it to be sent. This I have seen help make a lot of, just help patients get what they need in a timely manner. Because, if you are discharged from the hospital, the default pharmacy on the electronic health record might have defaulted to the hospital pharmacy, or we've had patients who, go travel in different places, or, might be staying in one place or the other. And this is a very common issue that we've seen. Just to make it nice and easy to prevent any sort of issues, I'd say whenever you call and request a medication, just say, I would like it sent to this place. And it's this address or this location. And this will make a big difference. Okay, I'm going to send this back to Ayaka.
So we'd like to talk about plan of care and advanced health planning conversations. These are really important topics of conversation, but that may be challenging for the patients as well as the care team members and the oncologists. But as Sarah has mentioned many times, that you are your own advocate, and the care team members really appreciate when patients are their own advocate, and you have every right to know to these information and ask questions and know the answers. So important topics of conversation to have with your care team: current state of your illness, treatment options available. A lot of times doctors use the words curative or palliative. Curative meaning that the intent of the treatment is to cure a disease and to lead to full remission. Palliative meaning that the treatment may be able to help alleviate symptoms or slow down the progression, but may not be curable. So what is the intent of the treatment? Are there any clinical trials available to you? What lies ahead with your illness? What do you expect from your illness? Ways of managing symptoms. If I have pain or fever, after the chemotherapy, what do I do? What are some of the things that can I do? Nausea, like all these very common symptoms. You can ask your doctor about how to manage those symptoms, and pain and side effects of treatment. And quick words on advanced healthcare directives and post. So advanced healthcare directive is a document in which you can express your wishes for the type of care that you want or you do not want when you may not be able to really express wishes on your own. In this document, you can also designate what we call healthcare agents. Those people who you can trust. It can be a family member or trusted friend who can express those wishes on your behalf if you are no longer able to express those wishes. And it's really important not just designating your healthcare agent, but also to have a conversation about the actual content of advanced healthcare directive and what are some of the quality of life that you like to maintain. What are some of the treatments that you definitely don't want? To have the conversation with your healthcare agents is very, very important. So POST is a physician's orders for life-sustaining treatment. So this is a document that is actually signed by a physician because it's a physician order. So this really sort of outlines a type of treatment and type of care that is, that you would, that reflects your wishes, and it is signed between the patient and the doctor. And these are, if you are interested or curious, please ask your doctors. And if this is something that doctor may not have a conversation to have with, there are other care team members who can answer those questions as well. And the next slide, please. And for, so some of the, so to go a little bit more into depth on these conversations, you can ask what are the goals of these treatments, pros and cons, how much will it cost, will my insurance cover my treatment? And again, your doctor may not know the answer to this question about like finances, but there are usually financial counselors or somebody in the billing department who may be able to really help you navigate these financial concerns. What are the typical side effects of this treatment? What are ways to manage them? Are there any new treatment options or clinical trials I should be aware of? What happens if there are no more treatments out there that can help me? Where would you recommend getting a second opinion? So it is a very, very common practice to get a second opinion, and chances are that your oncologist probably has a good idea of who would be the best person, the best doctor to serve, to provide a second opinion. Because a lot of times, physicians, consult with each other and whatnot. It's a very, very collaborative environment. So it's very common. Please don't feel bad for, getting a referral to a second opinion. It's you have every right to seek a second opinion. And you can also tell your healthcare team members, oncologists, I'd like to get a referral to, as we have discussed a little bit, palliative care medicine doctors, chaplaincy, social work for mental health support, dietitian, and or home health. You can also ask them, I'd like a copy of our Advanced Healthcare Directive or assistance with completing one. So Cedars-Sinai Medical Center actually has our own Advanced Healthcare Directive that anybody can go to the website and download and fill it out. There are also physical copies available in the clinics, but there are many, many different types of healthcare directives available. And once you complete one, that is applied to every single institution. So you don't have to use any specific one. You can just sort of pick and choose the one that fits your needs the best. Okay, so we have another polling question. Have you ever been confused by medical terms that your care team members used? And we wanted to ask this question because we wanted to help you understand a little bit about healthcare lingos that you may see in your doctor's notes. I'll give 5 more seconds. Okay, so one person says all the time. That has happened to me several times, 57%, so more than half. And I usually understand what my doctor or care team members tell me. So 2 people said they usually understand most of them. But yeah, it can be very, healthcare lingos can be very confusing. And Sari is gonna walk you through a few of the healthcare lingos that you may see in your doctor's notes.
Okay, yes. And I do want to say that we as healthcare providers think we are doing a really good job. By default, we think that we're doing a really good job explaining all these things, and we have no idea that we're doing a bad job unless you tell us. So please, please let your providers know when they are confusing you or using terms that you don't know. It is funny though, some of my patients have been in the healthcare system for a long time and they know as much lingo as I do. You all need honorary nursing degrees. But here, let me go through just a few things that you might see. These are some abbreviations. Then you'll see that some of these are not going to relate very intuitively to their definition because some of these terms come from Latin. So PO, that actually means by mouth. So that is often when it comes to medication. How is this medication going to be delivered? Oh, it's like a pill or something where it's going to go in by mouth, PO. SQ and SC, that's going to stand for subcutaneous. That's going to be an injection that goes to the fat layer in your arm or leg. IM can stand for intramuscular. That could be an injection that goes into the muscle, or it can stand also for internal medicine, like our primary care providers. IV is going to stand for intravenous. SL stands for sublingual. That is a medication that's put in under the mouth, under the tongue, and then it's absorbed that way. If you absorb something under the tongue, and not everything can be absorbed under the tongue, it'll actually can enter your system and be effective more quickly because it doesn't have to be digested in the stomach. NPO, that's going to stand for nothing by mouth. So that's often something you'll see if, say, you're going to have a procedure and they say, okay, you have to be NPO after midnight. So don't eat anything by mouth once you go to sleep. Or you can't eat anything by mouth for the next 4 hours or something like that. This is something you'll see, and it has to do with frequency. So QD is going to stand for every day. So you might have a medication ordered QD every day. QAC means before every meal. So that is, say, insulin is a good example of that. QHS is going to stand for every night. BID stands for twice a day. TID stands for 3 times a day. QID stands for 4 times a day. And PRN stands for as needed. I'm going to adjust. There's so much lingo involved. Please use resources online. I use them too because there are new abbreviations all the time. And so I really understand how confusing this can become. And I will go through this so quickly, but this is just an example of a note, which is not a real note, but just to see if we can talk about what these things mean. This is a 70-year-old male with a history of stage 4 mantle cell lymphoma on chemotherapy. He has basal cell carcinoma, has paroxysmal atrial fibrillation, status post, a permanent pacemaker, history of hepatitis C virus, status post treatment. Patient recently admitted for Nordic regimen, which is these chemotherapies here. Cycle 2, patient reported moderate nausea, vomiting, managed with Zofran as needed. Follow up with onc, primary care provider, and cardiology. So often you'll see the iology part is dropped when it comes to different specialties. I'll do one more real quick. 41-year-old female with past medical history of stage 4 rectal cancer, found to be anemic, responded to 1 unit of packed red blood cells. Patient has percutaneous endoscopy gastrostomy tube and receives chronic total parenteral nutrition. A computerized tomography scan of the chest, abdomen, pelvis demonstrates rectal mass and adrenal metastasis. Magnetic resonant imaging, MRI, demonstrates brain negative for METs. So negative means that what was looked for was not found. Positive means that it was found. Oh, okay, I think we don't have a lot of time. So Zofran 8 milligrams every 8 hours, IV push, metoclopramide 5 milligrams PO, which is by mouth, every 6 hours as needed. Marinol 2.5 milligrams PO by mouth, twice a day. And venous thromboembolism, so blood clot prevention, is ordered for sequential compression devices that squeeze your legs, and subcutaneous heparin on proton pump inhibitors. It's like a whole nother language. Okay, real quick, going back to Ayaka here.
So I know we're at the top of the time, so just quickly for providing feedback, if you're having issues with your care team members, either oncologists or any other care team members, it is helpful for them to know so they know where and how their service delivery can be improved. Offer your feedback directly to your care team members. This is always recommended. Let them know what your concerns are and what is helpful for you to continue care with their care team. And if if the issue is not resolved, each hospital has a department that can respond to your concerns. It's usually called patient relations or something similar. And again, positive feedback is always appreciated as well. So if you have any positive feedback to your care team members, please share with them as well. So with that, thank you very much. This is to conclude our presentation, and we can stay for another few minutes if there are any questions.
Thank you so much, Ayaka and Sarah, for this valuable information. We do have just a few questions if you guys are okay to answer them. I don't think it would take too long. Okay, perfect. Sarah, if you want to go ahead and turn your camera back on, if we can see you. Perfect. There you go. Hi. Okay. So the first question is, can doctors help with insurance issues?
So it's always helpful to ask. Like, you just never know what doctors know or don't know. For most likely, they're not the ones to answer those questions, but they can certainly make a referral to either social workers, a financial counselor, or somebody in the billing department who can help patients navigate those systems and financial concerns or health insurance concerns. And also, social workers usually have resources in the community that may be able to help connect patients with.
And also, depending on the issue with insurance, there are issues of which doctors are able to help with. So for example, if it is sometimes, depending on the insurance, they will often have a process where doctors can rebuttal and say, this patient really needs this medication, and fill out a form and send it to the insurance company, sometimes even talk to them on the phone. And often, if you have a physician's assistant or a nurse practitioner on the team, they're usually the ones who are going to be the go-to people to assist with that and be on the phone with the insurance company. So there are some things in which they can assist with. It depends on what the issue is.
Oh, okay. That's good to know. Do physicians connect/communicate with their mental health team, like psychiatrists or psychologists?
They have the ability to, as long as the patient gives that allowal. Doctors aren't necessarily going to know that a patient is following a mental health provider or a psychiatrist. And you have to let them have the ability to reach out, but then they can communicate. But it is one of those things where you might have a lot of doctors on your team, but they're not necessarily reaching out to everybody for regular updates. So just to keep that in mind, that your one doctor may have made a decision, but that doesn't mean that another doctor is aware of that decision. And so because of that, especially, and it makes it that much harder if they're not in the same health system and they're not using the same notes. And so that is really where you become such an incredibly important part of a healthcare team member, because you are the only one who has interacted with all the physicians and you are an expert on yourself. So yeah, sometimes you got to tell doctors like this doesn't work because of this. This doctor told me this, I can't do this. This one doctor might not know what another doctor said.
Yeah. I also want to quickly add that a lot of cancer centers, so Cedars also has our own psychiatrists and psychologists on staff. So that makes it a lot easier to communicate with each other. And that's really kind of the value of offering holistic care. So if you're someone who's seeking mental health care, this is something that you might be able to receive depending on the institution.
Okay, perfect. And the last question, this person put, I have Kaiser insurance. Do you know if a program for second opinion outside of Kaiser, or do you know of a program for second opinion outside of Kaiser?
I believe that I'm quite confident that I've heard of patients who have Kaiser insurance getting second opinions, but unfortunately, I don't know the process. I will say that there are medical tumor boards across California at most academic institutions And these are usually open to any provider, even if they're outside the system. So what I mean is like Cedars-Sinai has their own medical board, oncology medical board, and they have one for the different cancers. And they meet at this one frequency, maybe like quarterly or something like that. And oncologists from anywhere can submit a question for their patient and have their patient's case reviewed. So for example, my mom was a Kaiser patient and had cancer, which was a very rare cancer that is not, that there aren't a lot of people who are specialists. And so they sent her chart over to UCLA actually, and had the tumor board there review it and give their recommendations back. So that is something that should be available to all oncologists, and as like a baseline, even if you don't physically go into it for a second consult.
Oh, okay. Well, thank you so much. Thank you both so much. One last question. If they weren't able to submit their questions today or have anything else come up, are you guys okay with sharing your contact information?
Yes, please.
Absolutely.
Feel free to reach out. We are more than happy.
So if you guys are here today and you want their contact information, just go ahead and email us at info@cancersupportla.org, and we can definitely go ahead and provide you with that. And this is being recorded, so this will be up in our video library in a few weeks. But thank you so much, Ayaka and Sarah, for today. We do appreciate all the knowledge that you spread. We know that this is very important for people.
Our pleasure.
Thank you very much.
Thank you.
We're honored to be here.
Thank you. Have a good day.